The healthcare administrative waste and chaos in all of this is still a $260 billion problem. I think McKinsey did an analysis, and that's where this number comes from. There's still so much waste in healthcare.
I'm Jake Aaron Villarreal, born and raised in Silicon Valley, and here to take you behind the scenes to share what it's like to be a startup founder, the journey they're on, the problems they solve, the products they build, and effort to make our lives better. I'm excited to have with us today William Chan. He's CEO and co-founder of Iodine, an AI revenue management software company trusted by more than 1,000 healthcare systems nationwide. Prior to starting Iodine, William was co-founder and vice president of product at Crimson, a company focused on improving healthcare provider quality and profitability. William, welcome to the show.
Thanks, Jake. Glad to be here. Thanks for the invite.
Well, before we jump in, William, where are you joining us from today?
I'm here in Austin, Texas.
When I started this podcast, I had this vision to go behind the scenes to share what it's like to be a startup founder in Silicon Valley, where I'm born and raised. And weekly, we dive deep in the trenches to find the wins, the losses, and the lessons learned, with the hopes that it helps you run a better startup. But here's the thing. If you've gotten any value out of these conversations or been inspired at all, hit the subscribe button. And I get it. Your podcast feed's probably overflowing. But to stay up to date what's going on in Silicon Valley, stick with us. Because at the end of the day, we're all just trying to build something that matters. And we're better when we do it together. So hit that subscribe button and follow us wherever you find your podcasts. Now, let's get back to the show. Oh, nice. I love Texas. Lots of companies are in Texas. In fact, one
right.
You and I both worked at, Oracle, moved to Texas, and a lot of startups are innovating in Austin and Dallas and different parts. What was it that brought you to Texas, or are you originally from there?
No, I'm not originally from Texas, but I was brought here because of the growing startup industry that is in Austin. This was, quite a while ago. It's probably about 15, almost 20 years ago. I came here to join the startup environment, came to work at a startup company. I wanted to see if what was successful in Silicon Valley could be replicated outside of Silicon Valley.
Yeah. Well, we hear a lot of benefits about having a company in Texas, from taxes to talent to a lot of different things. Let's go back a little bit into your origin story. Where are you originally from? And kind of walk us through some of what shaped you to eventually get into being an entrepreneur in technology.
Yeah, happy to do that. I was actually born and raised in Malaysia, and I came to the US when I was 17 to go to college to study computer science. But one of the key things I still look back at this time when I came to the US, I didn't know a soul here. And so there was every concern for myself that things could get ugly for me pretty fast, fall in the wrong company or what have you. And so that's kind of when, kind of drew me back to my Christian faith as I was growing up, and I started to read the Bible quite a bit more. And one of the things that it talks about in the book of Genesis, for example, is, God kind of brings order out of chaos. And I really like that idea of bringing order out of chaos, of, if you will, bringing efficiency out of disorder. And that spoke a lot to me. And that really kind of shaped what I wanted to do and who I wanted to be. I wanted to be that person that, right, given my God-given talents, would be somebody who could bring order out of chaos, efficiency out of disorder. Given the background that I had with computer science, it felt like I had a role to play in building new technology, building new software, building new solutions that would allow me to do exactly that.
Yeah, I love that. I'm a Christian as well, and was baptized by Pastor Rick Warren at a Saddleback.
Oh, wow, okay.
So I go pretty deep there, and have been on missions and built a church in the Philippines and a lot of stuff that I don't talk about often. But it's funny that you bring that up, because we just had a podcast with another guest out of Mexico, and one of the stories he was talking about was, as you go out and raise capital, it's always important to do what you have to do, but also be patient. And it's trying times when you're trying to raise capital. And he was also a Christian. One of the things that he brought up was, God gives you the strength to have the patience, even during the tough times when you're trying to get what you want or go where you want. But it's not going as quickly as you want it to go. So,
Right.
it's good to have an anchor where you can pull from when you need to and also support you, because as a leader, people look at you, they look up to you, they look for your vision, they
Mhm.
look for you to solve their problems. But when you go home at the end of the day and you're in your bed or doing whatever you're doing, you don't always, you know, have the strength sometimes to figure things out, but it's always good to have something or someone or a way to problem solve.
I
So I
really like your word, Jake, that there is an anchor. Like, what is it that anchors me? Really, at the end of the day, to your point, what is it that drives me to come back and do what I do? Because, not every day is going to be easy. There are going to be
yeah,
those days where, you're going to get hit on all sides or just get punched in the mouth. And, you got to get up and say, okay, why am I doing this? Right? Is it
yeah.
worth it? And, I believe that I was called to do this, and my goal here is to do to the best of my abilities to deliver this efficiency out of disorder, especially in healthcare, right?
Yeah.
Which is the world I live in now.
Well, we'll talk about that. Give us the inspiration behind Iodine. So you had a company, you built it, you got acquired, you've had a lot of success as a leader. What was the inspiration? What was the problem you saw that you thought, you know what, this is something we could tackle, we could go out and solve and make the world better for
Yep,
it?
yep. So, prior to Iodine, as you mentioned, I had a previous company called Crimson, and that was my first introduction into healthcare. And the picture I saw inside of healthcare was an enormously complex ecosystem, but a highly manual ecosystem at that. A lot of processes, but the processes are managed and operated by people running very manual processes. And so basically, there is a lot of manual activity going on in healthcare. There is therefore a lot of manual or waste that is going on because processes aren't as efficient as they can be. And so Iodine's goal or Iodine's mission is we want to ensure that hospitals and health systems capture the full value of the care that they deliver. That means that they're getting reimbursed at the proper rate and that they're doing this as efficiently as they possibly can with the resources that they can. Some CFO at a hospital once told me a long time ago, no money, no mission, right?
Hmm.
You have to be able to do the work and be able to make some money out of it. Now, hospitals don't make a lot of money. Their profit margins are very slim, but they have to be able to keep a positive profit margin in order for them to keep on going. And so we believe Iodine is a part of that solution in ensuring that hospitals continue to be financially solvent and financially healthy.
Talk a little bit about the profit margins, because I know they're slim, but I don't know if the general public knows how slim it takes to
Right.
operate a hospital before it has to go belly up.
Well, a lot of hospitals operate, a typical hospital probably operate on a 3 to 5% operating margin. So that's pretty slim. When you compare that to, say, a software company where the margins could be 50% or more, right? So that's a huge difference, right? You're running a an operation that is essential to the well-being of an entire country. Hospitals are obviously, a required part of, and health systems are obviously required within the United States and within any nation. But you have to operate it at very much lower margins, and so you'd have to therefore operate it very efficiently. So we looked at some of these operational inefficiencies to see how we could try to improve upon them. Right? And when we looked at it, we saw that there were actually a lot of situations where clinicians, nurses, physicians, we're being recruited and used to make clinical decisions, but these clinical decisions aren't in the direct care of a patient. They serve to move the administration of a patient throughout the hospital, but they don't actually take care of the patient. Right? They take care of the administration of the patient. And when hospitals grow and they need more of these administrative processes to perform, hospitals have historically said we are going to just go hire more of these people.
Mm.
And hiring clinicians, hiring nurses, hiring physicians. One, there are not enough of them. There's a shortage of these people in the United States, and they're also very expensive. And so it's in that kind of environment where we looked at that and say, you know what, there is a potential technological solution that can bring additional efficiencies into this kind of a process.
So you're solving a couple problems. You're helping hospitals be more efficient with technology. The technicians or the clinicians are also making decisions on patients, right? They're looking at data. They're saying, this is based on everything you've done. This is what we think is the next thing you have to do. Maybe like making sure that they're aligned with the types of medications or whatnot. But if that goes wrong, then you have a patient that also is getting the wrong support, the wrong, what
That's right.
solution. Yeah.
Yep.
So talk to that
So
a little
yeah,
bit.
yeah, absolutely. So in a hospital, all right, hospitals want to make sure that they're delivering the best care they can to their patients. And in order to ensure that that is the best care, they want to make sure that the patient documentation, for example, is accurate, right? Approximately 30% of the time, the patient documentation isn't as accurate as it needs to be. That doesn't mean it's necessarily wrong. It's just not accurate and not as precise a description of what the patient is going through. So hospitals want to make sure that that documentation is precise. And in order to do that, they hire clinicians, nurses, and hospitals to double check that documentation to make sure that it's precise. Now, that obviously you can see where this manual administrative
Hmm.
work kind of comes into play. It's highly manual and
Hmm.
highly labor intensive and therefore inefficient. Can we use technology to review all of that and identify the times when the documentation is not accurate? Remember, only about 30% of the time is the documentation not accurate. So 70% of the time, everything's fine.
Yeah.
You know, you don't need to review. You don't need a human being to review 100% of all the documentation. You probably need technology to identify the 30% where it's not accurate and then dive into that 30% that is not accurate. So that's what our technology does. We try to identify the areas, that 30%, where the documentation isn't as accurate as it can be.
Yeah. That's great. Really cool. Well, AI is, integrating into every system and every industry and making leaps and bounds of how companies are operating and, tightening up efficiencies around how they, build products or manufacture or ship. In healthcare, there's lots of systems, archaic systems, lots of data. Getting into a hospital is probably half the battle of just getting them to take a look at your company. But you've been around, you've bootstrapped this and you've scaled it up and you've got thousands of clients. Couple questions. What was the decision to bootstrap this without raising capital like? And now where you're at today, are you able to continue to just grow and scale, or is raising funding at some point part of the picture for you?
Yeah. So in the early days, we wanted to make sure we had the product market fit, right? We didn't want to get ahead of our skis by raising a lot of money potentially and then just spending it on something that might not have made sense. It might not have stood the test of being in the real world, being used by an organization to solve a real problem. And that's why we decided we wanted to bootstrap it. We had to make sure that we were very efficient ourselves. We want to be efficient with our own capital. So my co-founder and I used our own capital to fund the company. And we wanted to make sure that we were solving the exact right problem. That's why we decided we wanted to bootstrap it and determine that we could do this ourselves. Otherwise, no one else should invest in us. If we can invest in ourselves and make sure that it's the right decision to be made every step of the way with the product, no one else should invest in us.
Yeah, that's smart. In those early days, going back to the bootstrapping, what was that like? I mean, you're building a business without funding. Did you feel like you had enough runway to create a solution that was going to have market fit pretty quick?
I think one of the things about being an entrepreneur is you try to be an optimist, right? And so you always think that you're going to be able to make it. In reality, you probably have to set some timelines for yourself. And so we set ourselves some timelines. We said, within 16 months, we're going to make our first, if you will, $10,000,
Yeah.
or $20,000. You gotta show some return, even if it's small, to show
Yeah.
that somebody is willing to put some put money where their mouth is or make a bet on you. So we set those timelines for ourselves, and if we were able to hit those timelines, then we would move on to that next stage and say, okay, we can take this on for another 12 months, right? But within the 12 months, we're going to double the amount of income that we're going to need to make. So you kind of set stages for yourself and attempt to hit them. And if you can hit them, you keep going. If you don't hit them, then you have to make some significant trade-offs.
Yeah. Well, you've got a lot of success so far early on. And I say early on, but you've been around for a while. What's the state of the company today? How big are you employee wise? You've
Yep.
got thousands of clients. Are you
Mhm.
recognized in the market in healthcare as like a big
Yeah.
player
Yeah.
in
I think, like you said, we have about, over 1,000 hospitals around the country that use our software. We are recognized as the leader in AI solutions, right? Specifically in revenue cycle management, in the area of clinical documentation and utilization management. We've been very successful there. We won multiple awards for the software and have high NPS scores from our customers. From a company size, it's still a mid-sized company, about 250 to 300 employees. We, again, like everything else that I talked about, we try to be very efficient with our capital allocation. We try to be very efficient with the teams that we build around the product and the teams that we build around managing the company.
yeah. You know, they say that, if you don't have problems, you don't have a company because it's about solving problems. You hope for the better problems to solve and not the bad problems to solve. But as a company, every company evolves and you have challenges to overcome and grow and scale and whatnot. What's the one of the bigger challenges you look at in the market today and face?
I think in any dynamic environment, especially like healthcare, where there is a significant desire to improve, there will always be competition. And so the biggest challenge is to make sure that you don't rest on your laurels, and that you're always looking around the corner to ensure that your product continues to deliver value to your customers, and that they're always delivering value in in a larger, better scale compared to your competitors.
Yeah, well said. As a leader, you've now got this company to where it's at today, 250, 300 people. The company has had some success, some breakthroughs. How have you evolved as a leader?
Huh. That's a great question. There's a proverb that says, "As iron sharpens iron, so one person sharpens another." I
Yeah.
think one thing that I've evolved as the company has evolved is that I've learned that just because you're the leader doesn't mean you figured it all out. And that's
Mm.
probably as you grow as a leader, you realize there's a whole lot more that you actually haven't figured out. And so you need help, you need answers. Chat GPT is all very helpful, but really you need others who are with you on that same journey, who can come alongside with you. So one of the things that I've learned is to ensure that I have others, other CEOs who can come alongside me, who can speak to me, help me through the challenges and the issues that I run through. I have an executive coach. These are some of the things that have helped me evolve, and the realization that I can't do it all alone, that I need a group of other people who will come alongside me.
Yeah. You know, Companies build products, but they're nothing without the people. So the fact that you're utilizing, whether it's a coach or an advisory board or just in
Hmm.
general, people that you can brainstorm with. I myself have a coach as well, and I think it does give you an edge to brainstorm, to solve problems, to see blind spots you don't see with yourself, and be
That's
able to
right.
strategize and really solve problems. But it all goes back to people. Talk about the culture that you've built and the type of people that fit your company from an innovative perspective, from a work ethic perspective. What's it like to work at Iodine?
Yeah. I think one of the key things in our world is we want people who are always curious and always trying to innovate. And so there's always a challenge, always a push that I try to cultivate with my team and have my team cultivate with their teams, is that we try to be innovative in everything that we do, that we try to be efficient, try to be effective in everything we do, but we also want to make sure that we are innovating. And it's not just in our product, but it's also in our processes. So there is always a push, a constant push for us to rethink how we do things, right? Whether it's building a new and better product or a new and better process internally, or how we serve our customers so that we can always ensure that we're doing the best that we can and as efficiently as we can. So I think that is probably one of the key cultural traits at Iodine. There's an innovation and a push towards innovation and towards effectiveness.
Yeah. That's well said. Innovation is important. You look at AI, and what the world sees today is, ChatGPT and the UI, and it's easy to use and brainstorm and get data very quickly. But you started your company way before ChatGPT was well known to public. What was AI like for you, machine learning wise, and now with LLM so prevalent? How has
Mhm.
that changed or shaped your company, if at all?
Yeah. Well, it definitely was the foundation of the company. Way back when we tried to solve this problem, we wanted to build clinical intelligence that would help administrators and hospital personnel make clinical decisions for administrative purposes. And we started by writing a lot of rules. We thought we could do it by writing a bunch of rules and just write programs that would just do rules. And very quickly came to the realization that decision making or clinical decision making is so complicated. You can't just simply write rules. And so we decided we were going to take the leap and use this newfangled artificial intelligence capability. Back then, it was machine learning, neural networks, and see if it actually worked. And so we jumped on the bandwagon early. And so AI has always been a foundational tool that we've used to build our technologies. So as new AI tools have come into the picture, like generative AI, like large language models, like agentic AI that's coming down the pipe now, right? We continue to just embrace these new approaches, these new algorithms, if you will, to see if they can better solve these same use cases, these same problems that we've been tackling for quite a while. Can we do that better with an LLM versus a machine learning model? And guess what? The answer is not always yes.
Mm.
LLMs are very good at certain things. Machine learning models are actually good at other things. And so over the years, we've been able to understand and know which types of algorithms, which types of AI approaches work best for the problems that we're trying to solve.
Yeah. Really good to have two perspectives, one where it was before the LLMs and now after. I think gives you a real advantage. A lot of companies are built on having a moat around their technology or their business so that they can protect and defend their space. Do you have a moat, or is that changed? Where are things at from how you defend what you've created in your territory,
No,
really?
the moat really is the fact that we've been using AI for a long time, and so we understand how you can apply the different kinds of AI to the different kinds of problems that you see along the way. We have built out machine learning models that have stood the test of time, right? And they continue to be improved upon. The precision of the predictions continues to improve over time. That's the moat that we hang our hats on, right? And that's the moat we'll continue to reinforce over time.
Yeah. Well, I like the position you're in. As you continue to evolve and look ahead, what are you excited about? What's on the roadmap that you want to take your company to in the next 12, 18 months or beyond?
Well, the challenge is that, the healthcare administrative waste and chaos and all of this is still a $260 billion problem. I think McKinsey did an analysis, and that's where this number comes from. There's still so much waste in healthcare. And so again, Iodine's continued mission is to go look into this world to see how else we can apply AI, how else we can apply the machine learning and AI models that we've built to address all these inefficiencies, to address all these pieces of waste. In my world, how else can we improve hospitals' ability to capture the value of the care that they have delivered to their patients? How else can we continue to make impact to the hospitals so that they continue to be financially sound and financially viable? that is the future roadmap. That's the mission that we continue to see. And the roadmap is how do we take all these new technologies, these new algorithms, and continue to apply them in additional use cases as we uncover them through our journey into healthcare.
Yeah. We're talking to and working with a lot of companies, specifically in the AI space currently, and some that are not. But one of the trends we're seeing are companies are hiring only those that have experience with AI tools. So
Mm.
think of an engineer, they might be coding, 90% of the time today, but with tools, with a cursor and different tools now, you might not only need to be coding, I don't know, 30% of the time or 40 or 50. We're seeing companies that are actually only hiring people now that have experience with AI tools and not just coding, but marketing and sales, and just are they interested in learning about those technologies that's going to make them more efficient and more effective? What's your take on AI tools in helping your own company optimize?
Oh, we're I'm always making sure that I'm pushing my team and the entire company to be utilizing all of these AI tools, right? In some ways, you kind of have to eat your own dog food. You
Yeah.
know, you want to make sure that you're using AI because that is the technology that we were also delivering to our customers. But the value is there. I can do a lot more with Chat GPT than I was able to do on my own before, right? And my
Yeah.
team, my marketing team, can put together copy a lot faster. My development team can write code a lot faster, right? It's still not perfect, right? They can write code, but the AI code sometimes still hallucinates. And so you still need people who understand coding, who can look through the code and double check the work, right? So it's still not as efficient as it can be. It's getting better. Tools like Cursor and what have you are always going to get better, but you still need the people who have the fundamental expertise in the business. You still need the best coders because the best coders will know when the coding that is being generated by AI isn't up to par. You still need the best marketers because they're the ones who can read the copy and say this is good copy or that's not as good copy.
Right.
But the the human in the loop is still key to ensuring that AI is leveraged to the best of its abilities.
Yeah.
We're
I
pushing
agree with
AI in every
that.
single way, but we're making sure that people are still checking to make sure that it's all right.
Yeah. I mean, I see this world, and my belief is that there's going to be multiple systems that have AI agents that humans are going to be orchestrating and managing the agents. And it's going to be for sales and for marketing, and for operations and for HR and all different departments. But it's going to take less people to manage the process of companies to be more efficient, more profitable, at the same time creating value that companies will want to use that company's service. So I think there's a lot of opportunities to win in the space, but we're ourselves looking at technologies that we could best use. And in fact, we actually built our own too. So we have a system that we built, which are AI agents that allow us to do our job better, faster in terms of looking for candidates and sourcing, but more importantly,
Mhm.
the communication between our clients. There's like a lot of friction sometimes between you told me you wanted to hire this kind of role. Here's the job description. We took it back to the team. They had some questions. There's a lot of back and forth. And I think this is what they said. Did they really say this? Let's clarify and verify. There's a lot of human back and forth. But to have a system now that can take what you need and what you want, put it into a system, we're validating. We think this is what you shared. We're sending candidates. It's getting smarter. It's now understanding you as a client, and you no longer have to tell us who you are, what you need, and no job hoppers, in this industry, it's got to
Mhm.
be this many years of experience doing XYZ. Like all that's going away. And now we're thinking before you're telling us because we know what you want. And that's the value that we're seeing in AI. So
Yeah.
that's more of a trusted value proposition that we're seeing really works, that now we're exploiting it and scaling it out. That's just one part of the business. But when I look at companies like yours, which is really saving lives on a mission to keep hospitals in business, doing the right thing for the country in a lot of ways, right? I mean, you're helping the organizations that are keeping people alive to stay around. And
Yeah.
that's,
Well, we're doing our part. Yeah.
you're doing your part, and I can't think of a higher mission to be a part of. So I'm excited to hear what you're doing today and where you're going, and for taking your time to share your story with us here. It means a lot. Hopefully it's going to save more lives in the future. I'm sure it will. If anybody wants to find Iodine or they want to connect with you, where do they go?
Well, you go to www.iodinesoftware.com, right? We're on LinkedIn as well, on Facebook. That's how you find us.
Very cool. Any last words? Anything else you want to share before we wrap up here?
No, I think we've talked through a lot.
Okay, really cool. Well, thanks so much for your time here, William, today. And for the listeners that have listened, it means a lot to me. You spent your time with us today. I'm your host, Jake Aaron Villarreal, signing off for now, but can't wait to catch up with you all on the next episode. Until then, William, the world, take care. If you like what we're doing, don't forget to subscribe. Leave a review on Apple Podcasts or wherever you listen. And follow us on YouTube, where we go behind the scenes to learn what it takes to be a startup founder.